to listen in.
Has been working with the provinces and territories to keep Canadians safe and address this pandemic. And this morning, I want to begin with an update on where this work stands. Yesterday, the Premiers and I, along with Deputy Prime Minister Freeland, had our 11th First Ministers meeting since this crisis began. We discussed the very concerning reports regarding certain long-term care homes in Ontario and Quebec. What the Canadian Armed Forces reported is deeply disturbing. That any senior would face this kind of treatment is unacceptable. But as I said to the Premiers, our government will be there to support them as we work together to ensure that our elders receive the care they deserve. In our meeting, we also talked about what we need to do together to help businesses reopen and get people back on the job while keeping our communities safe. Moving forward, it will become even more important to quickly identify and then isolate this virus. To do that effectively, we need to coordinate across the country. A number of provinces have already reached out to us for support on contact tracing, and our governments are currently working together on a data sharing platform. And yesterday, First Ministers were briefed on the work being done by the COVID-19 Immunity Task Force, which will coordinate blood test surveys across Canada. The Premiers and I also spoke about support for workers during this difficult time. Our government will continue discussions with the provinces on ensuring that as we enter the recovery phase, every worker in Canada has 10 days of paid sick leave a year, because no one should have to choose between taking a day off sick and paying their bills. Hier, les premiers ministres, la vice-première ministre Freeland et moi avons discuté.
Freeland and myself talked about the very disturbing reports we received this week about certain long-term care homes in Ontario and Quebec. As a country, we must do better for our elders. As I said to the Premiers, our government will be there to support them, and we will collaborate so that we can ensure that seniors receive the care they deserve. During our meeting, the Premiers and myself also talked about how we can work together to rapidly detect the virus and isolate it. The Premiers received an update on the work being done by the COVID-19 Immunity Task Force that will be coordinating blood test surveys across the country. We also talked about how we can support workers during this difficult period. Our government is continuing its discussions with the provinces to ensure that when we begin the recovery, everyone will have 10 days of paid sick leave per year. Our government is also working with the leaders of First Nations, Inuit, and Métis Nation communities to support them during this crisis. We have already made all kinds of investments, whether it's providing loans to Indigenous businesses, jobs for students, or services for people who live off reserve. But we know that there is a lot more to be done, and today we are moving to the next level.
We're investing $650 million to support Indigenous communities on health care, income support, and new shelters for women. Let me start with the first pillar, which is health care. Although we've made progress, there are still communities that are not properly equipped to handle a COVID-19 outbreak, and we need to address that. That's why we're investing over $285 million for public health in First Nations, Inuit, and Métis communities. These funds will go toward more nurses, will help procure specialized supplies, and will support work with First Nations, Inuit, and Métis communities on continued community-driven responses. Having the right health care is essential, but it isn't the only concern facing communities right now. Because of this pandemic, a lot of people also need a hand in paying for the basics. So, as a second pillar of this investment, we are boosting the On-Reserve Income Assistance Program. This money will support people living on reserve who need help paying for things like groceries, cleaning supplies, or rent. A portion of this funding will also help First Nations communities continue to provide services like skills training and support for people as they navigate federal benefits. The work being done in communities by members of the communities is incredibly important to help people get through this very challenging time. And that brings me to the third pillar of this funding, investment in shelters. In April, we announced $10 million so that emergency shelters for Indigenous women and children could adapt to the new challenges posed by COVID-19. This is vital support in the short term, but in the long term, more still needs to be done. So today I can announce that our government is investing an additional $85 million for new shelters for Indigenous women. These shelters will be built in communities across the country, including in the north. No one should have a place to stay when they're unsafe. No one should have a place to stay. No one should have to stay in a place where they're unsafe. No one should be forced to choose between violence or homelessness. These new shelters will offer a path forward when people need it most. Ce matin, j'annonce un
This
nouvel
morning, I am announcing a new investment of $650 million to help Indigenous communities get through this crisis. Of that amount, more than $285 million will be invested in health care. This is money that will make it possible to increase the number of nurses in First Nations communities and buy specialized materials. The funds can also be used to support the work being carried out in First Nation, Inuit, and Métis communities in order to find long-term solutions that fit their needs. We have also expanded the On-Reserve Income Assistance Program to help people pay for their daily expenses. And part of the money under this program will enable First Nations communities to continue to provide a number of important services. Finally, we are investing $85 million in new shelters for Indigenous women. These new shelters, which will be located in the communities, will provide women with a safe place and the resources they need when they need them most.
I want to end today with an update on another measure we've taken to keep Canadians safe. Earlier this morning, Minister Garneau announced that large cruise ships will not be allowed in Canadian waters until at least October 31st. This decision extends the one we made in March, which was taken to protect our coastal communities. COVID-19 is still a very serious threat, but with the right plan and with the right investments, we will weather this storm together. Merci.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Kate Balangaro, Bloomberg. Line open.
Hi, Prime Minister. I have a question about the Finance Ministry has updated the cost estimates for CERB and the wage subsidy that shows companies aren't using CEWS as much as you'd hope. And it seems that they're happy that the government is footing the bill for these programs. Is this smaller take-up of the wage subsidy a concern for you and the attitude you're seeing from businesses?
I think it demonstrates how hard this pandemic hit our economy and how many people actually found themselves without a paycheck, which is why we were glad we have the CERB to be able to support millions of Canadians who need help paying for groceries, paying their rent. But as we move forward and as businesses start to reopen and need to get people back to work, the Canada Emergency Wage Subsidy will become more and more important, which is why we extended it throughout the summer and will continue to encourage employers to rehire employees to be able to get our economy going once again. Okay.
We realized that this situation was extremely serious, and therefore direct help through the CERB did in fact help many, many Canadians who lost their paycheck. Now, as we reopen the economy and businesses start up and economic activity resumes, we need these businesses to rehire their workers and hire new ones, and the emergency wage subsidy will help businesses to do whatever they need to do to ensure our economy can recover.
So while China has remained quite vocal and firm in pursuing its more aggressive foreign policy, including towards Canada with the Meng case that we saw continuing on Wednesday, and Canada has been rather avoidant in using strong words against China. I'm wondering how much more aggression from Beijing will it take for you to stand up to Xi Jinping, and are you afraid of him?
We have continued to put Canadian interests and Canadian principles at the forefront of everything we do around the world, including with China. We will continue to work to ensure that Canadians have the equipment that we need to get through this situation, while at the same time expressing our concern for the 2 Canadians arbitrarily detained in China, and continue to highlight our concerns around Hong Kong and around questions that need to be asked for the WHO. We will continue to stand up for our principles and continue to look out for the interests of all Canadians. Okay.
We will continue to raise our concerns with China about Hong Kong and about the detained Canadians, and also what is happening with the World Health Organization, while at the same time ensuring that Canadians can receive the equipment and the help we need from around the world, including China. We will continue to always place the interests of Canada and Canadians first, and that's what Canadians expect us to do.
Thank you. Next question. Operator.
Thank you. Merci. Prochaine question, Michel Lamarche, TVA. À vous.
Mr. Trudeau, this morning we were listening to Mr. Garneau, who seemed to be saying that the survival of the airline industry was such that the airlines would not be able to refund Canadians. Could you be clearer with travelers and Canadians about this matter of refunds? Because Canadians want to be refunded. Obviously, our top priority is Canadians, and for people who need help getting through this crisis, who need support, and who need money in their pockets, that was what we decided would be our top priority, and that's why we intervened immediately to help them. We also are working with Canadians and airlines to ensure that we can find the right way to ensure that Canadians will be helped, while ensuring, of course, that we have an airline industry after this crisis is over. This is a very difficult situation in many ways, but we have clearly heard the concerns of Canadians in that regard.
Our focus throughout this issue, this pandemic, has been on Canadians, on getting them the support they need, which is why we put out millions, billions of dollars in support for Canadians to help them get through this. I hear clearly the concerns that Canadians have around their air tickets. We will continue to work with the industry and with concerned groups of Canadians to ensure that we find a fair way through this. But I know Canadians at the same time want to make sure we continue to have an airline industry after this very difficult pandemic. Getting that balance right and listening to Canadians is what we will do.
Michel?
Follow up? Yes, but I want to come back to the same issue. Is the survival of the industry threatened by these refunds to Canadians? Now, after the meeting with the premiers, are you seeing that there need to be national directives on the long-term care homes? Well, in our conversations last night with the premiers, we all agreed that we must do better and ensure that seniors right across the country receive high-quality service. No one believes that we should be doing less than that for our seniors. So we will be talking about how we can stabilize those homes now and help the provinces regain control, because we have heard the horror stories. But at the same time, there is a longer-term discussion that needs to happen on how we can ensure that in future years our seniors receive all the proper care and support they need.
Well, what we talked about last night was the importance of ensuring that in the short term we are giving to our seniors all the support they could possibly need through this very difficult pandemic. But we all very much agree that as we move forward, we need to make sure that all of our seniors everywhere across the country get the top quality service and care they deserve. And the federal government will happily be a part of those discussions as provinces lean in on this issue.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question. Mélanie Marquis, La Presse. À vous.
Oui, bonjour, M. Trudeau.
Good morning,
je veux
Mr.
revenir
Trudeau.
sur la question
I'd
de ma
like to
collègue,
come back to my
Michel,
colleague's
parce que,
question
en tout respect, vous n'y avez pas répondu
because,
du tout.
with all due respect, you didn't answer it at all with respect to refunds for airline tickets when flights were canceled. You say that your top concern is to ensure that Canadians have money in their pockets. But does that mean that, as far as you're concerned, airline tickets paid for by Canadians are luxury products that do not deserve being refunded, that should not be refunded? Well, no, of course, I understand that Canadians had to save some time in order to buy those airline tickets, and we will be working with the industry. We are currently looking at what other airline companies are doing around the world, and we will have more to say about that in the coming weeks. Okay. On another topic, Mr. Trudeau, your Minister of Defense, Mr. Sajjan, was quite clear about the fact that the troops in the long-term care homes cannot stay there for another 4 months. Can you explain to Quebecers and Premier Legault why Ottawa wants to now decrease the number of troops in long-term care homes? Well, the situation facing our seniors is extremely troubling, and as I've been saying from the very beginning, the federal government will be there to help Quebec and other provinces to regain control of the situation in those homes and provide seniors the care that they deserve. But, as I've also pointed out, having soldiers in long-term care homes is clearly a short-term solution, and we will continue to be there and to work with Quebec and the other provinces so that we can find the kinds of solutions for the medium term and the longer term that are needed. This is something we are looking at with the Premier of Quebec and the others, and we will continue to do that.
We will, as a federal government, ensure that we are there to support the provinces as they work to regain control over senior care in their jurisdictions. The situation going on in Quebec and Ontario is extremely worrisome, and we will be there to help. This is something that all Canadians want to see, and quite frankly, the women and men of our armed forces are there to protect Canadian lives and are happy to be doing it, even at risk to themselves. That's what they do, and we should all be incredibly proud of them. At the same time, I have stressed from the beginning that soldiers in our nursing homes is not a long-term solution. It's a short-term fix, and we will continue to work with Quebec and with other provinces to ensure that they are able to regain control over senior care in their provinces. We will continue to be there with them to find solutions for the medium and longer term.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau.
Écoutez, je voulais juste vous entendre.
Listen, I just wanted you to comment on something because earlier this week it was said that it was unthinkable to extend the confinement because it would be too much for the population, and particularly because it's particularly elderly people who are dying of COVID-19. So what do you think of that statement? Well, first of all, at the federal level, we are taking our advice from public health authorities who continue to stress just how important it is to protect all Canadians against this disease. The fact is that seniors are more vulnerable and have more of a risk of death because of COVID-19, but we have also seen deaths in all segments of the population, and we have to do our part in protecting the most vulnerable and all Canadians. We will continue to try to reopen the economy responsibly and gradually while basing ourselves on scientific principles and the protection of Canadians, which is our top concern. We cannot have a Canadian economy without Canadians, so we need Canadians, and those Canadians have to be healthy. A follow-up?
Oui, en fait,
Yes. Yes. On another topic, you talked about your call with the premiers yesterday, particularly with respect to the 10-day sick leave days. Now, what was the reaction of the premiers? Did you sense that they were not necessarily in favor? And a week ago, you offered to provide people to take telephone calls. You said they could take 23,000 calls a day. Did any of the premiers take you up on that offer? Yes, some premiers did take advantage of that offer for the purpose of contact tracing, and we continue to work with all the premiers in order to enhance their capacity, because we know that both testing and contact tracing will be absolutely critical if there's a second wave, or even if there's a local resurgence of COVID-19 in various communities in the coming months. With respect to paid sick leave, we did have some very good discussions about this again last evening, and there is a variety of opinions across among the premiers. Some people are concerned about the possibility of our not forcing businesses to carry even more costs during this period of uncertainty, but I reassured them, saying that the federal government would be assuming the responsibility for most of that support, because we know that in the fall, people may want to hide the fact that they're sneezing or coughing and go into work in order to be able to support their families, and that is not good for them or for the place where they work or Canadian society. So we have to avoid any situation where Canadians would have to decide between their health or going into work.
Prime Minister Julie Van Dusen, CBC. You mentioned, obviously, that soldiers they blew the whistle on the horrors that are going on in seniors' homes that a lot of families already know about, but they're not the long-term solution. Now, your letter here that you put out today after meeting with the premiers, you talk about agreeing to take action. I haven't heard any action. I mean, you can't go back on the soldiers because you say they're not the long-term solution. So can you be very specific? What is your action? Because people actually, when you say we're there to help, they actually want to know the details. Is it more money with strings attached? Is it national standards? I mean, what do those words mean?
We recognize fully that long-term care and senior care is a provincial area of jurisdiction. But all Canadians are united in wanting to see better support for our seniors right now and in the years to come. So we have said at the federal level that we will be there to support the provinces, both in the immediate, whether it's more rent money or more resources or whatever it is that the provinces need to get control once again over their long-term care facilities. There are a number of provinces across the country where, although there have been challenges, there are not nearly the scale of problems that we've seen in other places. So we recognize there is a great variance across the country. But as a federal government, our job is to look out for all Canadians and make sure that everywhere across the country people are supported, and we will be there, depending on what the provinces need, what their situation is, to make sure that all seniors are protected. Okay. Nous reconnaissons que
we recognize that long-term care facilities and care for seniors comes under provincial jurisdiction. But because this is of concern to all Canadians, and because we must ensure that all Canadians are protected right across the country, we will be there to support the provinces and address their needs in the medium term, in the long term, and in the short term. We are there with the Canadian Armed Forces, and there are discussions now about the need for money or other resources, because we want to help them regain control of their system, which is not the case in certain provinces at this time.
The issue isn't going to go away, but I need to ask you about mortgages, because you must be aware that some families are having to break their mortgage contracts early. So would you consider telling the banks to ease mortgage penalties for those Canadians who are stuck in this position because they have no work?
We have seen banks take significant measures on helping Canadians who have difficulties with their mortgages, and we will continue to work with financial institutions right across the country to ensure that they are there to continue to help Canadians. We know that this is a very, very difficult time for many families. We've made available many income supports, but there is always more to do, and we're going to make sure that financial partners are part of the solution to making sure Canadians get through this. Okay. Nous savons que malgré tout l'aide
We
que nous
know
avons
that in
offert
spite of all the
aux
help
Canadiens
that we've
par le
offered
gouvernement
Canadians
fédéral, il y
at the
a
federal level,
d'autres défis qui
there are
arrivent
other
et nous
challenges ahead of us,
nous attendons à ce que
and
les banques
we
fassent
expect
leur
the
part
banks
aussi.
to
Ils ont
do their
déjà
part as
pris
well.
des mesures pour
They
aider
have
les
already
gens
taken
avec
some
des
steps to
aides,
help
mais s'il y a
people with
plus
their
à faire,
mortgages,
aussi
but
qu'ils
if
vont
there's
en faire.
more to do, then I know they will step up.
David Aiken, Global News. Good morning, Prime Minister. So just to follow up on your first answer to Julie's question on the specific action. Okay, let's drill down. So the federal government was there to support provinces. What did Ontario, what do they need? What does Quebec need beyond soldiers? What does New Brunswick need? Can we hear some more specifics about what the federal government is going to do in individual cases?
The federal government will be there to support provinces and jurisdictions that need help managing their long-term care situations, whether it's Canadian Armed Forces in the short term, whether it's more resources or more money in the medium and longer term. We recognize this is a provincial area of jurisdiction that they are in control of, but we also know that having certain provinces lose control of the safety of their seniors means that we need to be there to support them as they regain control, and we will do that. But as you point out, there are a range of needs, a range of situations across the country, and one-size-fits-all from the federal government is not the best way through this.
No.
Okay. Nous allons être là pour aider les provinces.
We will be there
à
to support the
reprendre
provinces
contrôle
regain
de
control
ce qui est dans leur juridiction.
of whatever falls within their jurisdiction. In the short term, we are there with the Canadian Armed Forces, but over the medium and long term, we will be helping with more money, more resources, depending on their needs and depending on what the provinces ask for.
The federal government is playing the support role to provinces, but there is lots of places for the federal government to lead, and you have your own members of parliament, your own caucus have written you a letter saying, let's have some national guidelines on this. What have you said to Jen O'Connell, Gary Anandasangari, Vaughn Baker? I'm probably missing one, but what's your response? Where's the national guidelines? When are they coming?
Our members of caucus, not just those, but all members of caucus across the country, are worried about the plight of our seniors in this situation right across the country. They are more vulnerable to COVID-19, and they all want to make sure that we are doing everything we can to support our seniors right across the country, and we are. There are, of course, going to be a need to have very real conversations, not just between order of governments, but as Canadians, about how we make sure that we are properly supporting the seniors who build this country with their hard work, the seniors who deserve a secure and dignified retirement. These are things that all Canadians want to see us do better as a country, as a society on, and we will be there for those conversations in the medium and long term. But right now, we're still dealing with this emergency of getting people the support they need faced with this COVID crisis.
Bonjour, M. Trudeau. Louis Blouin, Radio-Canada.
Louis Blouin, Radio-Canada. Yesterday, there was discussion of reopening the border before June 21st, the border between the U.S. and Canada, for family reunification. Mr. Higgs, the Premier of New Brunswick, has already said that he is dubious about this. So where are the discussions on that, and what is on the table? Now, is that proposal being seriously considered? We are currently looking at a situation where permanent residents or citizens have a spouse or children or relatives with a very close, of a close relationship who are separated by the Canada-U.S. border and who cannot join their family members I mean, we have seen a number of stories about this in the news lately, touching stories about divided families. So we are currently looking at how we could make a small change for family reunification for very close family members. But of course, because I have always promised the premiers that anything having to do with the border and any measures that might affect them would be the subject of discussion with them in order to have their perspective on possible measures involving relaxing some of the rules in specific circumstances. Because, of course, the agreement we have at the border will continue to be in effect until the end of June as planned. But can there be some slight exceptions to that? I'm discussing that with the premiers, and I've heard some premiers who are open to that. Others have concerns. So we will continue those discussions and continue to ensure that we're doing the right thing by basing ourselves on the safety of Canadians.
We have taken unprecedented measures at the U.S. border to prevent non-essential travel. We've continued with our supply chains and with essential travel, and of course Canadians coming home who then need to quarantine for 2 weeks. But there have been a number of stories in the media over the past weeks and things we've heard directly from MPs on families who have close family members who are separated because of citizenship at the U.S. border. And we have been looking at ways of perhaps allowing close family members, children, spouses, or parents of Canadian citizens or permanent residents to be able to reunite under strict conditions through a slight modification of the directives for the Canadian Border Services Agency. This would not change the approach on closing the borders until the end of June, and depending on discussions beyond, but it is looking at can we support families that are going through extremely difficult times. However, the borders are an issue that deeply concern all the provinces, so I've made many commitments to them over the past weeks that we would always bring up any issues or concerns we had around changes at the border, and we had a good discussion on it last night. There are a number of premiers who feel that for reasons of compassion, we should and could move forward with this measure. There are others who expressed a certain amount of concern about it. We will continue to engage with them. We will continue to look into this matter and ensure that no matter what we do, we are keeping the safety of Canadian and well-being of Canadians at the forefront of any decision.
Juste pour préciser une chose là-dessus, à quelle
Just to
échéance verriez-vous
clarify,
ça arriver dans
what would be the timeline for that? And on paid sick leave, you said you would be prepared to assume much of the responsibility for that. Does that mean you will be willing to pay for the entire program? And is that enough to convince the provinces to get on board? We are still in discussion on paid sick leave, but what I've said right from the outset is that the federal government does understand the realities facing businesses with their costs these days, and we would therefore be assuming much of the cost of that investment, but the discussions are continuing. With respect to border measures, we are looking at something being said about this in the coming days, but as you know, the discussions are continuing.
So you say that military members in long-term care facilities needs to be short-term, not long-term. But the Premier of Quebec is asking until September, so it's only a few months. Why can't the Canadian government commit to having the military assist long-term care homes in Quebec at least until that time? Is there something else those soldiers have to be stationed to or sent to? Is there a reason that that commitment to September can't be made?
These are operational discussions that are ongoing between Quebec, the Government of Quebec and the Government of Canada and the Canadian Armed Forces. We will continue to have those discussions, and as I said, we will continue to do everything we can to be there to support Quebec as it works to regain control over its long-term care institutions.
What discussions have you had with Ontario Premier Doug Ford? Of course, his government cut $34 million to long-term care funding, and now his province is asking the federal government for financial assistance. Where does that leave the federal government in helping provinces if they've already cut budgets to vital services for seniors and long-term care residents?
I think many of those questions are the medium and longer term questions around what we need to do to ensure that our systems are properly able to support our seniors. But at the same time, right now we are focused on helping in an emergency situation, helping seniors, helping Canadians get through a very difficult situation. We will continue to be there for them. We will continue to work closely with provinces and give federal support wherever necessary. I just want to make a quick point on what is happening in the United States. Many Canadians of diverse backgrounds are watching, like all Canadians are, the news out of the United States with shock and with horror. Anti-Black racism is real. It's in the United States, but it's also in Canada. And we know people are facing systemic discrimination, unconscious bias, and anti-Black racism every single day. We need, as a society, to stand together, stand up against discrimination, be there for each other in respect, but also understand that we have work to do as well in Canada, in our systems that we need to work forward on. And I call on all Canadians, whether it's anti-Black racism or anti-Asian racism or racism and discrimination of any type, to stand together in solidarity, to be there for each other, and know just how deeply people are being affected by what we see on the news these past few days.
I'd just like to take a moment to say to Canadians who are seeing with horror what is happening in the United States, that even though this is taking place in the United States, Canada is not free of discrimination and racism, and therefore we have to do better. Whether it is anti-Black racism or anti-Asian racism or systemic discrimination, we have work to do here in Canada. And we have an obligation now and in the future to be together and to work with each other and show compassion and respect, because understanding the realities of various people can be a challenge, but I know that Canadians will stand together. We see that every single day in this pandemic, and we will continue to do that.
Thank you. Thank you very much. Julie, I just wanted to wish you all the very best in your next chapters.
Oh, thank you so much.
Thank you.
Prime Minister.